Brittany, do you want to kick it off or do you want me to kick it off?
I mean, I guess I can. That's fine.
Okay.
Just let me know when we're live.
Yep. I'm going to admit everybody. Okay, I think we're ready.
All right. Good evening, everybody, and welcome. Thanks for joining us. Happy October 1st. As you know, October is both Dental Hygiene Awareness Month and Orthodontic Awareness Month. So what better time to have our fellow hygienist, Lauren Gueits, on here, and founder of Airway Health Solutions, to talk to us about our roles as hygienists and the impact we have on the health of our patients' airways. So Lauren, thank you so much for hosting this, having me being on my podcast at the same time. I appreciate it.
I know. We're multitaskers as hygienists, right? We certainly are. Well, it's a thrill to be with you tonight, Brittany. I feel like we're old souls together or something, although we haven't met. Actually, Jackie Sanders brought us together. I think everyone knows Jackie, the editor of RDH magazine. And we share the same, I think, drive and passion for dental hygiene. And it's so much more than just the teeth, right? That's kind of like the tip of the iceberg, literally. And we're really healthcare advocates for the whole oral cavity, which is really responsible for airway, breathing. It's really important for our immune system to have a healthy airway, to have better breathing. So it's really quite ironic that October is National Dental Hygiene Day, Orthodontic Health Month, and then the Global Health Awareness Day, which is tomorrow, O2 Day. I don't know if many hygienists are aware of that, so I'm so glad that we're having this tonight, because I have a link in my chat where you can join tomorrow. It's almost like a breathe-a-thon, where it's 12 hours. It's going to start at 11 o'clock. It's through the Foundation of Airway Health, and it's going to be the who's who in airway. This is not just for professionals. This is for anyone who breathes, okay? So anyone who breathes, it's for them. And I think there's so many people suffering who don't even know it. I mean, I'm a good example. I'm an expansion myself right now. And for years, I just thought it was normal for me to take a nap at 4 o'clock in the afternoon, because I was just always doing, running. And it's not, I was dealing with probably some sleep disordered breathing, of not being able to fully breathe to my best capacity. So I'm also the patient now. But I'm so exciting that everyone is here tonight to discuss this topic. I'm just going to let people in as we speak. So.
Yeah, it's going to be super exciting. And, I'm so thrilled. I just partnered with Airway Health Solutions. I'm on their team now, and I couldn't be more honored to be a part of that and get to work with, leaders in this field. It means so much to me. So even more reason I'm super excited to be doing this with you tonight, Lauren.
And we're so thrilled to have you. Dr. Morali is thrilled to have you. It's really a key component, myofunctional therapy, to everything that we recommend at Airway Health Solutions. I mean, we can't go through one training or one seminar without talking how it's necessary. It's not an afterthought. It's a critical component to airway health and to maintain the work that we do with expansion.
Absolutely. Seeing as, again, it's Dental Hygiene Month, let's talk about how you got into dental hygiene.
Sure. Well, I actually grew up in the dental office. I was an assistant when I was age 16. I went from the McDonald's drive-through window to being a dental assistant, and I really loved working with patients. I always liked making them feel better, feel more comfortable. So I wanted to be a healthcare provider. So I thought that, I already have some experience with dentistry. Let me go ahead and go to dental hygiene school. And it's funny, because when you look back, I graduated in 91. It's almost like a different field, a different science. I was so concentrating only on the teeth and not the whole oral cavity, the whole, the foundation of really our jaws, which really can dictate the health of our teeth, so to speak. So The journey has been surreal almost, from becoming dental hygienist. Then I was in a comprehensive periodontal office, where it's a perio-prosto office, where we just did a lot of comprehensive care. But over the years, my definition of comprehensive care has changed. Right? So we were so I'm still very much into the oral systemic connection, because the head is connected to the rest of the body. But comprehensive care, what does that really mean? And now, knowing airway health, I can't imagine comprehensive care without being aware of the airway.
Absolutely. And where was that shift? Like, what was it that made you take that leap from traditional hygiene over to airway? Was it listening to a speaker, or what was it?
So actually, it was when I was at a continuing education course in 2006, and my Invisalign rep at the time was Alex McEnany, who I love, and she's a wonderful hygienist as well. But that's when I saw Dr. Moralia's first case that changed really my life in dental hygiene. It was a case called Evan. And it's a very popular case. It's in all the journals. It's actually in some of the articles that we wrote, so you can refer to that. But to see the dramatic change from what I thought was a periodontal condition that turned out to be, malocclusion, which then later Dr. Moralia had taught me when I worked at Align Technology, and he's on faculty, that the malocclusion is caused from underdevelopment. So the underdevelopment of the jaws causes the malocclusion. So I was so focused on the malocclusion, but there's a deeper root cause, and that's underdevelopment of the jaws. And how exciting is it that at this day and age, we can develop the jaws, even in adulthood. But the most exciting thing is that we can prevent underdevelopment of the jaws. We can prevent malocclusion. We can prevent sleep disordered breathing. So that's where the hygienists really, really have a critical role in the growth and development of the children. And really, they can change healthcare, I think, in my humble opinion.
My next question, how, important it is, how pivotal it is for hygienists to be airway advocates, and how we are such an integral part of an airway team, and making those assessments, whether it's catching it early, or even just anybody that's sitting in our chair, no matter what their age is.
Absolutely. I mean, it's almost like I used to have just my ortho goggles on. So people may know me from, I worked with Invisalign in their education department, and I did a lot of education nationally on, your ortho goggles. But really, it's about putting your airway goggles on and looking for things that we see every day in the mouth, but just looking a little bit differently. So for instance, if somebody has, say, cold sensitivity, well, how do you get from cold sensitivity to airway? And this is how, okay? So if you have cold sensitivity, what is causing that? And if it's from, say, lingual inclination, traumatic occlusion, chances are you're going to have a narrow arch, right? Like a V-shaped type of arch. So when you're closing together, you're going to be, and I've said this a lot, colliding rather than sliding. So those collisions cause damage to the hard and soft tissue. But it will also cause cold sensitivity. So when you think about the underdevelopment, what can we do about that? And also, when we have underdeveloped jaws, it's those narrow arches, there's no home for the tongue. So the tongue is really crucial in breathing, to have enough space for the tongue to live, so to speak. So if you have narrow arches, you're not going to have a home for the tongue. You're not going to be able to be a healthy breather. You're going to be a mouth breather and have some form of sleep disordered breathing as you sleep, maybe even apnea from it blocking the airway. So there's many symptoms of sleep disordered breathing that we can go through with our patients, and many times they correlate to our regular discussions, depression, anxiety, ADHD, bedwetting in children, things like that, that you may not connect the dots. But if the cause is underdevelopment of the jaws causing malocclusion, then what's the ultimate solution? It would be really development of the jaws to create a healthy airway. So these are the conversations that you can have chairside. We do a lot of training on this to teach step by step. I know it's very difficult to kind of do a condensed version of this, but it's important for the patients to relate to what you're saying. Because not only are, we hygienists, sometimes we're the patient, right? Our patient comes in, they're actually, consumers. They're coming in basically for a cleaning in their minds. So it's a little far-fetched that you're going to go from there, okay, I'm here for a cleaning, now talk to me about airway. You're going to have to bridge the gap to why they came in the first place. So usually it's symptom-based or it's prevention-based. So once you educate on the root cause of that, they really appreciate the time you take to tell them and show them what's happening in their mouth.
Yeah, I think the loyalty that they feel to you, to the office after you come in and you're having this conversation with them about their whole body health and how it's all connected. And, you're not just looking to get them in and out, clean their teeth, get them scheduled for, a filling on 18 distal or something.
Right.
You're making these connections that affect their lives, their personal relationships, their family life, everything. I mean, what we can help do for these patients, it goes so much beyond the dental chair. So, when people used to ask me why I liked being hygienist, I was like, oh, well, I love to make people smile. I love to make people love their own smile. So imagine the even bigger, greater impact that you will have when you are diving into airway and you're able to discuss this with your patients and really get to those root causes. I mean, it's the best feeling in the world.
It is, and it really, I still do clinical hygiene. I've done it up until March. I took a break. I'm in New York, so post-COVID, I haven't gone back, but I did it voluntarily because I actually loved treating patients. Right? And especially with my new airway goggles on, holy smokes, if I see 8 patients a day, I'm having 8 conversations a day. It's crazy. And out of those 8 conversations, I would say we end up with 2 or 3 consults and probably one person either in clear aligner therapy as an expansion or an actual expansion appliance. I worked in an adult practice. So so that was really the goal I had, was to get to the root cause of the disease, which can be traced back many times to underdeveloped arches, underdeveloped jaws. And there's so many great resources out there, Brittany, as you know, so many great books that you can refer patients to read that are patient friendly, that they cannot see for themselves and not give an overload of information.
That's why when I talked to James Nestor, I was like, I love your book because you had nothing in it, writing it. He is a journalist and he went on this personal journey on his own. He wasn't, involved in this field, and it's such an easy read, and it's spreading so much awareness to the general public, which is both of our passion, Lauren. We talk about this all the time. So yeah, recommend books, get them talking about it. Maybe they're on the fence or they don't really believe that they have this issue, and you start talking about sleep, tell them to track their sleep. Or if you're talking to a parent and you start asking these questions, about their children and how they're sleeping, maybe they don't know. Maybe they're past the age where they go in and check on the patient, but tell the parent to video the kid. Exactly. I mean, it's literally, you can't say no to that. I mean, if you have a video of your child snoring or maybe stopping to breathe, that's evidence. So anything that we can get to educate our patients, make this more aware. And I think it's so funny that not only, again, is October Dental Hygiene Month and Orthodontic Month, but tomorrow's also the Global Awareness Day. So I just love how everything's like all tied in to just even emphasize that even more.
And it's amazing how most people are really concerned with 2 ways they lose their teeth. Because if you think about it, why are they coming to us in the first place? Sometimes we tend to lose sight of that, right? And their biggest fears are cavities and gum disease, right? So we really need to educate. There's a 3rd way you lose teeth, and that's a bad bite. And I think that's, once you can tie in the gum recession, the cold sensitivity, the notching at the gum lines, the effractions, and all the things that they're like, holy cow, I didn't realize this is happening because of my bite. No one's told me this before. And then if you do your oral cancer screening and you can see the underdeveloped and the narrow arches and the high vaulted palate, the tongue isn't going to be there. So it's really just kind of getting to the root cause of disease and relating it into a way that it's not too much information. It's really about connecting with the patients and providing, value for why they're there and how you can help them keep their teeth for a lifetime. Because a bad bite is really the true cause of most of our dental disease is the traumatic occlusion.
And even think about all those, the kids that come in where the parents are like, I don't get it. I don't know why they keep getting cavities. They don't have sugar. They have a good diet. We're doing everything right. Why do they keep getting cavities? Well, they're mouth breathing. So here we are talking about, tomorrow being global breathing, oxygen awareness. They're mouth breathing. Think of what happens when we mouth breathe. There's lack of saliva. Our mouth is dry. We all know what happens as hygienists with that. Saliva is so important. We need saliva to help prevent, and clean our teeth. So it's just so multifactorial, all the patients, that we can help. Lauren, is there 3 quick, what would, if a hygienist is on here right now and this is the first thing they're hearing about airway and they don't even know where to start and they're going to go to work tomorrow and the first patient in their chair, what are 3 things they can look for?
Well, it's actually the oral cancer screening is actually an airway screening. Mm-hmm. You just have to look at things differently. So do your same oral cancer screening, but really look at the oral cavity. Look at signs where, the same things you're looking at with your oral cancer exam. Look at the roof of the mouth. Is it vaulted? Is it V-shaped? Is there an imprint of the tongue on the palate? So the roof of the mouth is a key. Look at the tongue. We're looking at it for oral cancer. Are there signs of that scalloped tongue? Okay, tongues aren't scalloped genetically. Okay, they're scalloped not because the tongue is too big, but the home is too small. So if you have scalloped tongue, chances are that you're going to be having sleep disordered breathing issues because there's no place for the tongue to go but back. Cheek biting, that's another sign, right? Why are we cheek biting? Because we're collapsed, we're underdeveloped. Something called a Mallampati score. So when you're looking at the patient and you ask them to stick their tongue out, look to see if you can see their tonsils. There's a scale of 1 to 4. If their tonsils are kissing, that's a 4. If they're wide open, there's a 1. So it's just kind of raising the awareness level of being able to say, okay, educate yourselves, take some courses, but it's really right there. You're doing it all along. You just need to look at things differently.
Just have to put your airway goggles on.
There you go. Wayne Dyer said that, when you look at things differently, things change or change the way,
Yep. So and that's why, the name of my podcast, I Spy with My MyoEye, since I took my very first intro course, and you've taken an intro course in myofunctional therapy too, Lauren, it's all I see. I mean, you literally, once you see it, you can't unsee it. And then people in your life start to see it too. And they're like, hey, Britt, look at this person with their mouth open or their mouth breathing. It's just so funny.
Yeah.
Want to share a little bit about your expansion journey, because a lot of people think, oh, adults can't be expanded. Is that really possible? So here you are, proof that it's possible.
Yeah, so actually, I don't know, do I look any wider to you yet, Brittany? It should be about 1.5 millimeters. So I have a 2-screw appliance, and I'll show, it's basically, it almost looks like a Holly retainer, like from a teenager. But there's 2 screws that literally open up. So you can kind of see it's much more open when I first got it. So that's progress. And then every 2 weeks or so, I turn it. I just got a Propel device, which helps to accelerate the process. So I've been going to weekly turnings. So I'm going to be on my 5th turn. And then it's basically just expanding and remodeling the dental arches. So it's really not uncomfortable, which is exciting. But what it's going to do is, if you see my smile, I'm inclined lingually. Mm-hmm. So it's going to widen me, create more room for my tongue. I won't have the scalloped tongue anymore. Hopefully I won't have that daytime drowsiness. That's probably my biggest symptom. But other people who have sleep disorder breathing, they may have digestive issues. They may have depression. They may have anxiety. They may have ADHD, things that are so common that we just don't correlate with sleep disordered breathing. And if we have time, I would love to show a couple of cases that Dr. Moralia has done so people can see for themselves, because I'm a big fan of showing and telling. So this is a new platform for me to just talk. I love to show and tell because it's so powerful. And I do recommend that with your patients as well, to have some examples to show and tell.
And you're in a lower appliance too, correct?
I am. So the reason why I did that was because I just wanted to try everything. So I had different types of aligners. So in the lower teeth, when they're lingually inclined, you're just going to simply upright them. And aligners can do that very easily. But I also wanted to see if there was a more economical way and not having, say, a huge lab bill with, aligners where you could do the bulk of the movement with an expansion appliance and then finish with the aligners. So that's what I'm experimenting with right now. And I'm blogging along the way. So check out my blog. You're a part of my journey, which is wonderful. I was going to go I have a tongue tie. So I had a visit with Dr. Scott Siegel. That's in my blog. You can see all about that. And then I stopped and visited Brittany virtually so she could help me train my tongue for when I get my frenectomy. And don't worry, we won't show that live. But
we should. That would be really cool.
For us hygienists. So yeah, so I'm excited along my journey. It is the expanders. You do need to wear them while you sleep, and then at least 6 hours during the day. So I can see where this would be very difficult if I was a teacher, if I wasn't working from home. It's not impossible, but it's definitely more difficult because you can't speak with them in. That's why I have them out right now. But what I do like about it is that I don't feel like a prisoner to them 24/7. Right. So for me, it works out well, especially when I'm working from home, a couple of hours in, a couple of hours out. So it's very doable for me.
And then I think you were saying that you do the adjustment at night. That way, you're sleeping.
Yeah. So even like I recommend that with aligners too. So when you change to your next set, or when I'm about to do my next turn, I put the Propel in, which does help with comfort. So that's a nice plus, which I'll go over in my blog. My next blog entry is going to be about Propel. So I do that and basically just kind of bite into it. It almost looks like a U-shaped ring that I bite down on, and the vibration helps the inflammatory response. So it actually provides some comfort and also biologic change. And then I'll put in the expanders and sleep with it. So by the time I wake up, that first initial tightness isn't as, as obvious as if I put it in the middle of the day.
Definitely. So what do you think? Do you want to share some photos first?
Yeah, let's share some before and afters, because these really are exciting. And let me go ahead and share my screen.
And for anybody that will be listening to this episode on my podcast, maybe we can, get some kind of link, or we can, we'll figure something out.
We'll be creative. I'm sure we can figure it out, but maybe we can actually talk through it. But first, let me just let you know that the ADA actually made a brochure on recognizing sleep disordered breathing. So let me just go to, I have to move around these things, slideshow. So I don't know if everyone was aware about this, but this is pretty exciting. The ADA has a new brochure that you can buy, and it's talking about, kind of preventing this and screening what the parents should watch out for. So I find that it's always nice to have something like backup, especially from the ADA. So here are some signs and just a nice little brochure that the ADA now is offering. So I thought that would be helpful. But if you look at a case like this is a 16-year-old, and Dr. Moralia went through this last night, but I really wanted the hygienist to see this because we really don't want to focus on the teeth. And that's kind of against our nature, I think, right? It's like we go right into the teeth, caries, whatnot, but these teeth are not crooked. And I think that's the biggest misconception we have. So there's no such thing as crooked teeth. The teeth aren't anatomically bent, right? So they're actually beautiful teeth, just in the wrong spot. It's underdevelopment of the jaws. The foundation is underdeveloped. So rather than extract the teeth, which luckily the 16-year-old, her parents, they had many consultations where they said that that extractions were the only options, and they did not want to extract. And luckily, thankfully, they found a practitioner like Dr. Ben Moralia, who would never do an extraction. And I say never, I mean never, unless the tooth is decayed or diseased. So, so let's take a look and see. This is quite remarkable, and I love extreme cases, because if it's new to you, you know, we would have thought that it's possible to do this type of expansion, especially on a 16-year-old. So let's see, it was difficult to get in here. This is from Kevin Ohlendorf and Ohlendorf Appliance Labs. They do a wonderful job. If you ask for the the airway appliances that Dr. Moralia uses, he can really do a nice job. And let's see this result. Because to me, if I saw this back in 1991, this is magical. I mean, look, how can we compare decades of life that the 16-year-old and the dentistry and the surgeries she would have had if not going to an expansive orthodontist. So someone just saying Ohlendorf is the best. Yes, he is in the chat. So that's wonderful. So to me, this is where the fun is, and this is where you can truly make a difference in saving lives. So when you see the before and the after, you know, what's really important, if you're doing your airway screening for your oral cancer exam, this is showing that vaulted palate, right? There's no place for the tongue to go but back. So I'm sure the 16-year-old, I don't know her, but you can guess at the symptoms she has, you know, anxiety, depression, ADHD, you name it, she probably has it from lack of breathing. You know, oxygen is essential, as we know. So let me just view some of these people in the waiting room. Okay, so that's the upper, and then let's take a look at the lower. So truly remarkable. You can kind of see the crowding here. But again, she has beautiful teeth in the wrong place. Mm-hmm. So it's not that the teeth are crooked, it's the foundation is underdeveloped. So let's get to the root cause and develop the foundation. This is a nice case because this was done with expanders and then finished with aligners. And she had tremendous symptoms before. This photo was given to her by given to Dr. Moralia by another doctor for the before picture. But we were able to go from 27 millimeters to 34 millimeters with the expander. So I'm actually 29 millimeters across. That's called the transverse measurement. And James McNamara from University of Michigan has what's called the McNamara measurement, where he found that uncrowded adults were anywhere between 34 and 39 millimeters. So 29 is really narrow. So that's why I went with an expander and not an aligner. So I want to get probably to about 35, and then maybe the aligners would do the rest of the tipping to get me to 39. So I get 10 millimeters of expansion. So that's after the aligners.
Wow.
Right? And you can see she has these undersized laterals, but you're able to create the space to really do a great job just with a little bit of bonding until she matures more to get the veneers eventually. But it's really a beautiful case. If you see the before, she suffered so much from headaches and TMD, and this is actually post-ortho. This is somebody's after, okay? So keep that in mind. She's completely underdeveloped arches, and look at the dental alveolar bone. It's really remarkable because you're actually growing bone. It's really, really, you can see that here in the dental alveolar remodeling. So really, really a beautiful case. This is an example, right? Airway goggles on.
Wow. Look at that palette.
This is just done with clear aligners. This is Dr. Daniel Norris' case. I worked with him. This was actually Invisalign Shootout winner. I forget the year, but a while back. But Dr. Norris in Manhattan is wonderful. And Tom came in and he was told that he needed surgery, that he couldn't get palatal expansion. He would have to have surgery for it. And ideally, Tom, because of the vault, would have really benefited from expansion first, so you can lower the vaults and actually have true palatal expansion, but he didn't want that. So we also have to listen, you know, to our patients if they're not going to be compliant. So then he was able to get aligners, and look at the difference just from uprighting. You know, uprighting kind of got a bad rap for a while because, or tipping got a bad rap with aligners. But it's actually very good if you do it buccolingually, not so much mesial distally if you have a diastema, right? But buccolingual, it's great because you're going to.
Some hygienists might be wondering. Because I'm sure that there's some either dentists or whoever out there that would say that doing this adult expansion is going to cause periodontal issues.
Well, it would if you have a fixed appliance and if you're pulling and there's too much force, absolutely. So yeah, what we learned in hygiene school is that recession is a contraindication to ortho, but they meant brackets and wires, you know, that not clear aligner therapy, which is a removable. You know, all the removable appliances have that intermittent force, which actually builds bones. So it's more so from the bone research from that you can see the bone remodeling is from intermittent force, osteoblast, the osteoclast. So aligners are great at doing that. So you're actually getting dental alveolar remodeling with the aligners, but you're actually getting sutural expansion with the expanders. So ideally, if he hadn't expanded first, this vault would have dropped a little bit, providing more room for his tongue, right? But he has 10 millimeters more of expansion.
That's incredible.
So he increased his oral capacity volume just from aligners. So he will definitely benefit because now his tongue has more room to live. And I don't know this, I should follow up with Dr. Noor how he's doing, but it's really a wonderful story. And you can see too on the bottom, he had that scalloped tongue, the tipping in of the teeth that we always see. So common, it's more common than not. But this is just a good example of Tom's teeth weren't crooked, there's just not enough room. So when you open up and tip, and you can do that either with the lower expander and or with aligners, you're creating more space. And many people have beautiful teeth, they just don't even know it. It's just in the wrong spot. You know, the improvements when you're talking about creating recession, it's really exciting that you can actually heal the recession because you kind of expand into it, and that's with aligners. So with brackets and wires, it's a pull force, so you can actually cause some recession and damage with too much fixed force, but the intermittent force actually rebuilds and remodels, where this is such a nice slide that you can see the clefting, the recession, the non-carious class 5 lesions in the before, and the angles here from the trauma, from the narrow arches. You know, the teeth aren't bent in, it's that the foundation is underdeveloped and narrow. So we want to expand that. And once you do, you go from those horizontal forces to vertical forces, which then look how this healed up so nicely.
Yeah.
You can see the clefting almost zipped up, right? And there was actually, this is Dr. Ben Moralia's case, but he did not do this filling, okay? But it serves as a marker for us because it blends so nicely, right? You can see this composite, but look at the gingival margin here. It really almost zipped right up. And then these non-carious lesions, you know, they're non-carious. So very comfortable waiting and watching here. Not so comfortable waiting and watching here anymore, because we're just waiting and watching it for it to get worse, right? Because if it's the trauma causing it, you remove the trauma, and then the patient, there's so many benefits from uprighting. You're going to increase their oral volume capacity, as well as provide more room for the tongue and provide a healthy occlusion. So it's really a win-win. In fact, I can't imagine taking ortho and expansion out of the equation, because then we're really just treating many times the symptoms of malocclusion or the symptoms of underdeveloped jaws, because malocclusion is a symptom of underdevelopment.
These pictures are incredible. Definitely. We'll have to somehow find these to make them available for the ones that will only be listening to this. I mean,
absolutely. Well, you know, I'll make this a YouTube video, and then they can go ahead.
Oh yeah, perfect.
And go to that. And then you see this thing too with Dr. Moralia's case here, in a fraction like this, You know, a lot of people, especially out of school, what are the options? If she's sensitive, right? Well, we're going to do a class 5 buccal composite. How's that going to work out for you? You know, I don't even have to tell you. Or we can do a graft. How is that going to work out for you when there's so much pressure on that lingual cusp causing this trauma?
Mm-hmm.
So if the own biology doesn't hold true, how is a graft or composite material going to hold? So once you remove the trauma, look at this nice healing. Now it's not completely healed up, but she's not symptomatic. So this is another sign of waiting and watching and getting to the root cause rather than treating the symptoms. So another nice job by Dr. Ben, for sure. But it's interesting, right? How we were taught, what we were taught is almost like the opposite of what I would do now.
Oh my God, 100%.
You don't know what you don't know.
Yeah, I was on the phone with the
I'm surprised that we don't have nightmares about all the things we told our patients to do, back in the day.
This morning, and she was saying how she had taken a myofunctional therapy course and she felt, really overwhelmed. And I'm like, that's normal. I'm like, you're basically learning to look at everything completely different than you learned in hygiene school. And then it's almost like you kind of, I don't want to say feel guilty because you can't know what you don't know, but then you think back to all these patients that have been in your chair that you didn't catch these things on, but you can't think that way. You can only move forward and think about all the lives that you're going to change after this.
Absolutely.
And that's why I always laugh when people tell me, oh, airway's a fad. I'm like,
oh, yeah.
Airway a fad. We have to breathe.
Exactly. And not only that, if you tie it even closer to what the underdeveloped arches causes a lot of dental destruction. So you can bring it back home to the teeth, and then you can kind of build from there. I like to start where either doctors or hygienists are or patients are. They're coming in for you to keep their teeth for a lifetime. If the root cause is underdevelopment of the jaws, then it's our responsibility to at least provide that as a solution.
Right. This is just going to increase stability. Yeah, it's just going to increase the stability of any dental work that you are going to do. So again,
exactly.
It's that office loyalty.
Exactly. So this is her after. What's also nice about when you're uprighting the teeth, not only are you helping with that transverse dimension, but you're increasing the vertical. So that's another way that you're going to increase your oral cavity volume is by uprighting. You actually have more room for the tongue as well because of the vertical dimension. So really exciting. There's no intrusion here. Dr. Morale is not intruding with the aligners. He's simply a little bit proclined and expanding. And once you upright those molars, it's really incredible what you can do. I call it magical, It
is magical.
It is magical. Almost unbelievable. In fact, when I said in that 2006 where I first saw Dr. Morale's case, in fact, I think I have it here. Let me see if I might have added it to the end. Yes. This was the case that changed my life. This was Evan. So I referred to this earlier, and this is probably one of Dr. Morale's most popular cases because, first of all, he's 23 years old, right? And you can see before I knew anything about ortho, about airway, all I could think is what a periodontal mess he was, right? And get me that Cavitron. Can't wait to do my non-surgical scaling or root planing, which is necessary, obviously, but it's not the root cause. So this, to me, I actually thought was photoshopped when I first saw it. And now that I know that Evan's a true and real person and that Dr. Morale did the treatment, it's really, really incredible what we can do with just clear aligners. It's really, really unbelievable. So this was actually an Invisalign case. So that's the passion. It was my aha moment where I could not see this anymore. And when you see traumatic occlusion like this, something's got to give. The force has to dissipate. What gives is the hard tissue and the soft tissue. So orthodontics is such an integral part of the hygienist's kind of scope that many times it's the root cause of perio. It's the root cause of recession. It's the root cause of isolated pocketing. It's the root cause of clefting and recession and cold sensitivity. So really exciting to have this in your toolbox. I couldn't work in an office now that didn't offer clear aligner therapy and expansion. I just would know what to tell the patient to do.
Right? You'd be like, go see Dr. Moralia.
I know, I couldn't do that though, right? That would be unethical.
That's true, but in your
But
head,
that's what I would want to say. But there are a lot of doctors like Dr. Moralia out there. I mean, we've trained through Airway Health Solutions, hundreds of, we just started a year and a half ago, so over 100 doctors now, and that really warms my heart because they've treated, hundreds of patients. So we need more of these expansive airway doctors, I call them. Dr. Scott Siegel, he loves airway dentists because he sees for himself how important expansion in oral cavity volume is. So working with him is really a joy as well. I know you work with him too.
Oh,
So
gosh, great.
it's a team approach. It's a multidisciplinary team approach. And the myofunctional therapist is a key part of it. So especially after expansion, during, you need the diagnosis, what's causing the underdevelopment. Maybe Brittany, you can talk a little bit about that. As far as
about the underdevelopment of
of what's why a myofunctional therapist is so important with underdevelopment.
Right. Yeah. I mean, think about it. I mean, Lauren kind of already, said how there's no way the tongue is resting in the right place. I mean, there's literally just no room for it. It's completely displaced. So, once the patient goes through expansion and they actually have, I'm going to air quote, real estate up in the roof of the mouth for the tongue to live where we want it to, it's not just going to magically bounce up there. Although all these pictures seem very magical, it's not magical for our muscles to just be able to know what we want them to do. So that's why the myofunctional therapy is so important, because we're neuromuscularly repatterning the muscles to basically optimize function. So getting that tongue strong enough to lift up there. Now that we also increased the airway and we're able to actually breathe through our nose and use it the way it was intended to, we can work on that lip seal. Because think about it, sometimes these patients, the reason they don't have that competent lip seal is because they can't breathe through their nose. So they have to breathe through their mouth, or what else is going to happen? It's not going to be good. So you need to find what the root cause is. You can't just start working with the patient trying to get them in that proper oral rest posture that we talk about, which is, again, tongue resting up in the roof of the mouth, lips closed. We can't just expect that if there is a physiological barrier why they cannot breathe through their nose. So one of the first things, for myofunctional therapists is we need to refer to an ENT to see if there is some kind of physiological barrier, if it's, tonsils or adenoids or deviated septum or whatever the case may be. We need to make sure that these patients are actually able to breathe. So once we get this wonderful expansion, like in these beautiful pictures, and we can breathe through our nose and we can work on getting that tongue resting up there and the lips closed, that's where the myofunctional therapy component is so crucial, because we need to relearn these muscle patterns.
Right. And that's why I look forward to working with you. Even though I took the course, I have to say, I took it in 2013, and it's not like, poof, I'm a myofunctional therapist, right? I wish that was the case. So I know you put a lot of hours and a lot of dedication to do what you do and to do it so effectively. So we have a question from Anne, and I think this is better for you,
Sure.
Brittany. Should myofunctional therapy precede or follow expansion and development of the oral and facial muscles?
So this is a good question. I like to see the patient before so I can understand their case a bit better, but there isn't much we can do until that expansion is really complete. Because think about it again, if there's just not enough room up there for the tongue to rest, it's like, what's the name of, oh my God, the name of the book, 3 Foot Tiger.
Dr. Felix Liao.
Yeah. Foot Tiger. Yeah.
I know, I always get mixed with that too.
I always say it backwards. So yeah, you definitely would go through the bulk of your myofunctional therapy program after expansion. There are some myofunctional therapists that don't even want the referral until after they've been through expansion. So you might see them before expansion, but your work with them is really going to be once that room is really created.
Terrific. Yeah, so I think those are all the cases I have to show, but I think it is helpful to kind of show a little bit about, we're talking about it hypothetically, but I think it's really important to see and think about your patients too when you're educating your patients, how much more beneficial it was for you when I showed you these cases compared to just imagine the vault. So that's a huge tidbit, is to don't think you're taking more time by showing and telling. You're actually taking less time because it's less words. It's instantaneous understanding, and they do appreciate the time. The other resource is the righttogrow.org video. Do you recommend that too, Brittany?
Oh yeah, definitely.
So it's righttogrow.org. There's a great video showing the importance of growth and development, and there's a lot of research behind it that was put together by an advocacy group. So there's no agendas behind it. It's really just people who suffered from extractions and retractive orthodontics. So it's righttogrow.org. You can Google that on YouTube. And let's talk a little bit about if anybody wants to learn. I'm just going to go to this slide. We have courses coming up to teach dentists how to implement airway into their practices. So let me share that with you. So there's like a delay here.
I see the screen. Oh no, it's the pictures.
It just, yeah, it's kind of like I said Zoom quit. You're still there, right? You're still
I'm
here?
here.
I'm so afraid of the Zoom demons. They scare me. Hold on. Okay. Who's interested in incorporating this into their practice? That's what Dr. Moralia and I have developed.
Ooh.
It kicked me off and muted me, so somebody didn't like what I was saying. Hi, Ms. Smith. I see you joined us too. So we have courses in October and November, and you can take them separately. If you're just interested in the pediatric component, you can take the one-day course. You can take the adult course. We have them October 16th, the 23rd, November 6th, and November 20th. I highly encourage you to watch Dr. Moralia and Dr. Liao's webinar. It goes through all of the anthropology. It goes through a lot of the cases. So you can really see from start to finish, we can't really do it in this amount of time, to go to our airwayhealthsolutions.com webinar to look at those really other miraculous magical cases, as we call them. So let me last put the screen on for Global Awareness Day, because that's tomorrow. I can't believe it. I know Howie Hinden put a lot of time and energy into that. He's going to make it a great day. It's 12 hours. So let me go ahead and share that information for you.
So exciting. I love the idea behind it.
Yeah, and what's nice, it's free. How great is that, right? So it's like, okay, it's great, it's educational, and it's free. So please, if you can't remember the link, it's globalo2day.org. Just Google it. You'll find it's all over the place, Global Airway Health Day. And you can get your virtual ticket. It's basically a Facebook Live running for 12 hours. And they're really a wonderful celebrity, the who's who in airway. Their stories, again, this is not just for practitioners. This is for anybody who breathes. And it's always nice to donate to this cause to help raise awareness. So I'm glad we have this time, Brittany, together to help promote that.
Absolutely. Everybody should log on. Even if you can't stay logged on, log on for a little bit. If you can, and you want to donate, even if it's a small amount, I mean, anything will help. The cause is unbelievable. So definitely log on.
And then lastly, if you want to follow me and Brittany and Dr. Siegel and Dr. Moralia on my airway expansion, please go to our YouTube channel as well as the blog. It'll have a little bit more details on the written blog, but I also encourage you to use this for patient education. I specifically made this very patient friendly. So it's not meant to educate practitioners, but more so to do it in a patient friendly way so you can help connect with your patients on an adult expansion journey.
Yeah. And does anybody else, maybe that's in the Zoom, have any questions? If you want to, can they type in the chat box?
Yeah, they can type it in the chat. I've kind of been looking here as far as the chat goes. In Zoom, I haven't seen anything, a couple on Facebook that we had, but does anyone have any questions? about ortho, expansion, the hygiene role. There's a lot to learn for sure. But the good news is it's once you learn, it's really not overly complicated. It's just anything new is usually kind of intimidating, right? So don't be afraid of it. Let me see. Okay, I don't think we have any questions. So I'm so glad you're on our team, Brittany. I'm glad we had this time together.
Yes, me too. And thank you everybody for taking the time to come on and chat with us as well. We hope you enjoyed the presentation and we'll see you soon.
Happy National Dental Hygiene Day, everybody.
Yes. Good night.
All right. We'll see you tomorrow, Global O2 Day. Bye-bye. Good night.